Dear colleagues, welcome. In this lecture, we will cover botulinum toxin treatment for the glabella region. Our structure will follow: applied anatomy, aim of treatment, patient selection, injection technique, dosage, complications, and practical pearls. This is not a superficial overview, but a course-style training. This will be a complete lecture series. If you have not watched the previous videos, please visit the channel. In the upcoming ones, I will continue to share key insights, so make sure to subscribe not to miss them. Let us begin with the anatomy. In the glabella region, we deal with three main muscles: the corrugator supercilii, the procerus, and the depressor supercilii. The wrinkles we observe here are created by the contraction of these muscles, the typical frown lines. This expression is often associated with anger, but in daily life it also appears when concentrating or focusing, sometimes even unconsciously. Some patients will tell you, "Doctor, my brows always look furrowed." The corrugator, located bilaterally above the brows. When it contracts and shortens, it pulls the brows medially and downward, creating two vertical lines. If one corrugator is stronger than the other, the wrinkle on that side will be deeper. You will notice this frequently. In fact, once you are trained, you will find yourself analyzing people's mimics everywhere, at the supermarket or in daily interactions. The procerus, located in the midline, a single muscle. When contracted, it pulls the brows downward from the center, creating a horizontal line at the root of the nose. Even if not always obvious in every patient, inactivating this muscle is important. The depressor supercilia, a smaller muscle, pulling the medial brow downward, reinforcing the frown. In practice, seat the patient in front of you and ask them to frown. This will reveal the borders of the muscles and show any asymmetry. Remember, we are not injecting the wrinkle itself, but the muscle responsible for that wrinkle. The goal is to reduce vertical and horizontal frown lines and to soften the angry or tired appearance. We do not aim to completely paralyze the muscle, but to reduce its activity. Natural expression must remain, while lines are prevented from deepening. In my clinical approach, in women, I often like to reduce activity almost completely, as this provides a rejuvenating effect. In professionals who rely on facial expression, teachers, judges, presenters, I stay more conservative. In men, I also usually start with lower doses. Male muscles are stronger, but most male patients prefer a more natural look. I avoid giving too much in the first session. If necessary, I adjust at follow-up. And let's be honest, life is stressful for everyone, so nearly all patients suffer from these frown lines. Dynamic lines appear during contraction and respond best to treatment. Static lines are visible at rest and may require adjunct treatments. Important note, the glabella and nasal root are considered high-risk zones for fillers. Safer alternatives for skin rejuvenation in this area include mesotherapy or monoscrew threads. Hyperkinetic and hypertonic patients require higher doses. Men usually require higher doses too, but it is safer to begin conservatively and adjust later. Standard mapping involves 3 to 5 injection points, 1 point for the procerus at the root of the nose, 1 point per corrugator, about 0.5 to 1 centimeter above the orbital rim. Optional 2 lateral points covering corrugator tails and frontal fibers. Reference doses: Botox, 20 to 40 units total. Dysport, about 50 units, with a range of 30 to 70 units. The injection is performed perpendicularly into the muscle, but without contacting the periosteum. Important: determine injection points after observing muscle activity and borders during frowning. Injection itself is performed with the muscle relaxed. Note, you may see different maps used by different practitioners. Do not let this confuse you. The aim is always the same: deliver the product to the right muscle in the right dose. Eyelid ptosis is the most unwanted complication and very frustrating for patients. It is usually unilateral. Many of you will recall cases that even went viral online. Most often, it is caused by injections placed too close to the corrugator tail or by excessive dose. The toxin diffuses downward, affecting unintended muscles. Sometimes patients rub or massage their eyes after treatment, causing downward spread. Always give clear instructions. Do not rub your eyes or touch your face. Patients may not realize how important this is, so repeat it. If it occurs, the effect may last up to 2 months. There is no immediate correction, but do not abandon the patient. Reassure and follow them closely. Glabellar flattening and broadening may occur if muscles are overtreated, making brows look unnaturally spread. Asymmetry may result from uneven marking or dosing. Tips and tricks. Men usually need higher doses than women. Women generally look best with a softer, more complete inactivation. Always start conservatively in the first session. Adjust at follow-up if needed. Always document with standardized photos and videos. This protects both you and the patient and helps them appreciate their progress. In this lecture, we covered applied anatomy of the glabella, the goals of treatment, patient selection, injection technique, dosing strategies, and prevention of complications. If you found practical knowledge in this video, please like it. This will help the YouTube algorithm and allow us to reach more colleagues, because knowledge grows when shared. If you have questions or experiences, share them in the comments. I will be happy to answer. See you in the next lecture.